Well, we're here with Dr. Vuong today from Washington, Washington, and the city is called Federal Way. What a name. Dr. Vuong, hi.
Hi, how are you?
Good. Dr. Vuong, tell us a little bit. You know, you're a dentist, Dr. Vuong, and most of us patients, we're sometimes not so sure, how dentists are different. And to a degree, we believe that a dentist is a dentist is a dentist, which might be true. And at the same token, not all of you do all of the same type of work, and don't all of you have the same philosophy in your practice. So, Dr. Vuong, why don't you tell us a little bit about your philosophy in your practice, and maybe you can even tell us how you became a dentist. What makes a person like you becoming a dentist?
Well, every dentist is a little different. I became a dentist because I enjoyed working with my hands and I enjoyed helping people. And I think dentistry really suits me because I like helping people and working with my hands. And I've always loved science. And that's why the profession fits me really well. As far as the difference between dentists, I think every dentist sees things differently. You can go to 10 different dentists and you'll get like 10 different treatment plans.
Right.
Every dentist is going to be slightly different.
So what makes, what is your philosophy in the practice? Are you working more like very, very high-end cosmetic cases, give everybody a Julia Robertson or a Tom Cruise, Brad Pitt type of smile? Or are you doing that at the same token? Are you more concentrating on doing what's, I think, called functional dentistry, to make a person's mouth, reasonable good looking, but very important towards function, because, sometimes that extra, so to say, different beauty is almost like cosmetic surgery. It costs a lot of money, and it's not necessarily appreciated, needed, and wanted by many people. But what is needed and wanted is, of course, fixing the everyday dental problems, to make sure no infections are in the mouth, to make sure, the big holes are fixed. Basically, are you doing implant dentistry, cosmetic dentistry, but at the same time, are you also, what used to be, or what is still called the family dentist who, fixes the toothache, does the root canal, make sure the fillings are done, make sure the children are well taken care of and get their sealants done, and things like that. Give us a little background there.
We're definitely, I would categorize my practice as a family dental practice. We see patients from newborns to 100 years old. And we do see a lot of the cosmetic cases. We do implants, but we also do just the routine dental procedures like fillings, crowns, bridges, pretty much everything. We've got it.
Well, I'm sure if you do 100-year-old people, that some of them, even though they could have implants and stuff, they probably also will want to have dentures or replace their old dentures, and so you're doing that also, I assume, right?
Yes, we are. We do quite a few dentures in our office, as we do see quite a few elderly patients that need them.
Okay, well, all right. Here we go. So basically, yes, the family can come, mom can come, can bring her little kid. The kid can see how the dentistry isn't necessarily so painful, can get used to the dental office, and eventually, gets dentistry done him or herself, the little child. And if people do want to have a nice makeover, so to say, then you can do that too.
Yes, that's certainly the case.
And you admit that every dentist will have a little different approach of it than the other dentist, which doesn't necessarily make it worse or better, just slightly different, as I call it. Is that true?
I'm sorry, you were cutting out a little bit. Can you repeat the question?
Sure. Well, you said that every 10 dentists will give probably 10 different treatment plans, and it's not necessarily that those 10 different treatment plans that one is a lot worse than the other one or one is a lot better than the other one. It's just that they're slightly different approaches, but not necessarily worse or better. They're just different.
It's not necessarily better. Some dentists are a little bit more conservative. Some dentists are a little bit more aggressive in their treatment plan. Some dentists, offer only the best, offer a comprehensive treatment and allow the patients to choose what they want. My practice, I try to offer the patients all the options. I try to educate them and give how they want to treat their mouths. And as I tell them, a doctor is really a teacher of dentistry, and I'm there just to educate them and service them to how they want to be serviced.
Right, I see. So the difference is that some dentists, they might already exclude certain type of treatments because they feel that isn't, let's just say, quite so good. And that might not be true. Basically, they limit a little bit like in politics. We do vote, but we only vote for 2 or 3 people in the first place. They're already given to us, so we're not really voting all the range through. And some dentists do that with their patient, but you basically educate them on everything. Your statement about a dentist being a teacher is, of course, very true, because in the definition in the Webster Dictionary, if you look up, a dentist is an educator, a dentist is a teacher. Doctor comes from a teaching period, and that's a very great approach to take. Thank you very much, Dr. Vuong, for telling us what it is all about in your office. Bye bye.
Thank you very much, Helmut. Bye bye.